Your baby's first year is full of cuddles, coos, and incredible change, but it's also when their health and development need the most attention. In this video, we'll walk you through your baby's key growth milestones, checkup schedule, and vaccination timeline, so you feel confident and prepared every step of the way. Newborn to 1 month, the foundation. From the moment your baby is born, doctors start monitoring their health. In the first month, you'll likely visit your pediatrician within 3 to 5 days of birth. They'll check weight and length, jaundice, feeding and diaper output, reflexes and alertness. Most babies lose a bit of weight right after birth, but they typically regain it by week 2. This is also when your baby receives their first hepatitis B vaccine, often right after birth or within the first 24 hours. 2 months, the first big checkup. At 2 months, your baby is growing fast, usually gaining 150 to 200 grams per week. This is a major checkup where your doctor will look at eye tracking, neck control, social smiles, hearing and response to sound. And yes, it's the first round of multiple vaccines, including DTaP, diphtheria, tetanus, pertussis, IPV, polio, HIV, Haemophilus influenza type B, hepatitis B, if not already done, PCV, pneumococcal, and rotavirus, oral drops. It might seem like a lot, but these vaccines protect against dangerous diseases when your baby's immune system is still developing. For months, baby is engaging more. By 4 months, most babies can smile spontaneously, lift their head during tummy time, track objects with their eyes, and begin to babble. This is when your pediatrician will check for muscle strength, growth progress, emotional and social development. They'll also receive the second round of the same vaccines from the 2-month mark. Pro tip: bring a favorite toy or pacifier to comfort your baby during vaccinations. 6 months, rolling, laughing, and teething. At 6 months, babies are more expressive. They may roll over, sit with help, laugh and make vowel sounds, and start teething. Your pediatrician will check their sitting posture, reaction to sounds and faces, fine motor skills, like grabbing toys. Vaccines at this visit usually include DTaP, polio, HIV, PCV and rotavirus, and many babies are ready to start solid foods. Iron-rich cereals and pureed veggies are great first choices. 9 months, crawling and curious. By 9 months, your baby might be crawling, sitting without support, and developing stronger hand coordination. This visit includes developmental screening, growth tracking, hearing and vision checks, and a review of stranger anxiety or social behavior. Most vaccine schedules do not include shots at 9 months unless your child is catching up or traveling internationally. Pro tip: babies at this age love to imitate, so talk, sing and play with them often. 12 months, one big milestone. A full year of growth, can you believe it? At 12 months, babies may stand or walk with help, say simple words like mama or dada, feed themselves with fingers, and show strong attachment to parents. This well baby visit includes a full developmental assessment and new vaccines, MMR, measles, mumps, rubella, varicella, chickenpox, hepatitis A, and a final dose of PCV and HIV if needed. And don't forget, your pediatrician may recommend a finger prick anemia or lead screening test. Understanding vaccine side effects and safety. Vaccines are incredibly safe, but mild side effects like low-grade fever or fussiness are common. Here's what to do: offer extra fluids, use baby-safe fever reducers if advised, give comfort and cuddles. Serious reactions are extremely rare, and your doctor is always there to guide you. Important note: keep a vaccination record and bring it to every visit. It's your baby's health passport. In the first year of life, babies undergo tremendous growth and development, which can be exciting and sometimes overwhelming for parents. Regular well baby visits and vaccinations are essential to monitor this progress and ensure the baby's optimal health. Let's explore the typical schedule for these visits and vaccinations in detail. During the newborn period, typically within the first 3 to 5 days of birth, you'll have the first well baby visit. The healthcare provider will assess the baby's overall health, checking things like weight, length, vital signs, reflexes, and any signs of jaundice. They will also provide guidance on feeding, diapering, and basic care. Additionally, some vaccines are administered during this time, such as the hepatitis B vaccine, which is recommended shortly after birth. At around 2 months of age, you'll schedule the second well baby visit. This checkup allows the healthcare provider to evaluate the baby's growth and development, assessing milestones like head control, social interaction, and response to stimuli. They will also administer several vaccines to protect against diseases like diphtheria, tetanus, pertussis, polio, Haemophilus influenza type B, and pneumococcal disease. Around 4 months, the third well baby visit takes place. During this checkup, the healthcare provider will continue to monitor growth and development, assess motor skills, and check for signs of hearing or vision problems. Another round of vaccinations will be administered, including those for diphtheria, tetanus, pertussis, polio, HIV, and possibly rotavirus. At around 6 months, the fourth well baby visit occurs. This is an important milestone as the baby's diet is transitioning to include solid foods. The healthcare provider will assess the baby's readiness for solids, check for developmental milestones like rolling over, and administer additional vaccinations for diseases like measles, mumps, rubella, and varicella. Around 9 months, the fifth well baby visit is scheduled. During this checkup, the provider will assess the baby's mobility, fine motor skills, and language development. They will also review any concerns regarding nutrition, sleep, or behavior. While most vaccines are up to date, some may require additional doses at this stage. Finally, the sixth and last well baby visit of the first year occurs at around 12 months. During this visit, the provider will comprehensively assess the baby's development, including gross and fine motor skills, language, and cognitive abilities. They will also administer any outstanding vaccinations, including those for measles, mumps, rubella, varicella, and hepatitis A. In addition to the well baby visits, it's important to note that certain vaccinations are typically given during the first year of life. These vaccines play a crucial role in protecting infants from potentially life-threatening diseases. For instance, the DTaP vaccine is administered at 2, 4, 6, and 12 months to protect against diphtheria, tetanus, and pertussis. The HIV vaccine is given at 2, 4, 6, and 12 months to prevent Haemophilus influenza type B infections. Similarly, the pneumococcal vaccine is administered at 2, 4, 6, and 12 months to safeguard against pneumococcal disease. Other vaccines include the hepatitis B vaccine, which is given at birth 1, 2, 4, 6, and 12 months, the rotavirus vaccine, which is administered orally at 2, 4, and 6 months, and the oral polio vaccine, which is given at 2, 4, and 6 months. The MMR and varicella vaccines are typically given at 12 months, but the timing may vary depending on the manufacturer. It is important to follow the recommended immunization schedule to ensure that your baby receives the necessary protection against infectious diseases. Congratulations on reaching the end of this video. We've covered a lot of information about your baby's first year, including the key milestones, checkup schedule, and vaccination timeline. Remember, you've got this. Partnering with your pediatrician and embracing the journey. Don't forget to give this video a like, subscribe, and share it with fellow parents. Feel free to drop your questions and comments below. Thanks for watching, and see you in the next one.